Hello, my name is Isabella Wakeling, and I will be presenting on behalf of my group members, Katie Dong, Luz Diaz, and Tram Duong on school health. Education should not be the only priority in school. The safety of students, teachers, staff, and the implementation of healthy habits is also a highly sought-after component of the schooling system. School health is especially relevant with the rise of the COVID-19 pandemic. Schools are now having to adapt to new learning environments and have the responsibility of ensuring the safety and health of all on and off campus. Let's start by what school health is and what comprehensive health is. School health is an environment that promotes healthy habits and creates meaning in the health of others in the school system. The image on the left shows the fundamentals of school health. They include social and physical environment, teaching and learning, partnerships and services, and healthy policies. They work cohesively, and the well-being of those in school settings cannot function without all components working together. Comprehensive health is a planned program that schools create to support students' optimal growth in social, emotional, and physical health. This model is holistic and focuses on the many aspects that are vital to the health of students. Content areas that are to be taught in comprehensive health are nutrition and physical activity, growth, development, and sexual education, injury prevention and safety, alcohol, tobacco, and other drugs, mental, emotional, and social health, and personal and community health. Nutrition and physical activity content areas can be seen in the implementation of healthy eating and physical activity in schools. Growth, development, and sexual health contents can be seen in sexual education classes that are required of all K-12 schoolers. Injury prevention and safety can be seen in wearing helmets and wearing seatbelts while driving. Alcohol, tobacco, and other drug contents can be seen in DARE programs and resisting drunk driving. Mental, emotional, and social health can be met with on-campus counselors that provide resources for students to further pursue their mental health. There are health education standards that must be met nationally in every school in the U.S. in order to ensure healthy behaviors. Just a few of the standards met include comprehending concepts related to health promotion and disease prevention to enhance health, analyzing the influence that family, peers, culture, and media has on health behaviors of students, the ability to access valid information, and to enhance health, to demonstrate interpersonal communication skills to reduce health risks, to demonstrate the ability to make rational decisions to enhance health, goal-setting skills, enhancing behaviors to avoid health risks, and advocating for personal, family, and community health are also important education standards. The advocacy portion is very important because it shows that students can demonstrate and advocate for health not only in their own lives, but they find enough importance to share it with their personal family and among their community and peers. Presented are the health education standards specifically for California Public Schools K through 12. Much of the content is similar, however, it is more geared and specific to be designed for each school. A few of the requirements met are the learning of essential health concepts in schools, analyzing health influences, accessing valid information, and being able to differentiate between educational and non-reliable sources, interpersonal communication with those around them, decision-making that enhances mental health rather than risk it, goal setting to meet physical, mental, and social well-being, practicing health-enhancing behaviors, and health promotion. If school health is an area of interest that you have a passion for, along with the patience and willingness to work with kids in school settings, then you may want to consider a few of the health science options in school health education. Provided are the CSULB major requirements for school health education, starting with the lower division courses, followed by the upper division courses. Also provided are the CSULB major requirements for the double option in community health education. As follows are the lower division courses, and upper division courses. Each major option requires 64 to 70 units upon completion, and obtaining these majors can be beneficial in pursuing any career in school health. School health is only beneficial when it is impactful to those at most need. When health is implemented in schools, students show high academic success because of their ability to monitor their own health and ensure that they are providing their best efforts and energy into their academic success. They also are less likely to engage in risky behaviors that involve doing drugs, drinking and driving, smoking, sexual education behaviors, condom usage, etc. They're also better mentally, socially, and physically because of the resources that are provided to them in the school settings. In a study done when staff and educators provide resources and ways to promote healthy and safe habits in schools, students build a high level of trust in the environment that they're in, and they're more likely to approach and confide in adults regarding their health and safety. When they know that those around them take their health and safety at utmost priority, they are more likely to build trust and to confide in these people regarding their health. In a study done by Catherine Grant, students were put into different focus groups involving food and nutrition education. These programs were shown to have positive effects on the students, and after being involved in these food and nutrition education programs, they reported higher attendance and enrollment in school. As you can see in the following slide, The students reported positive effects in nutritional status, enrollment attendance, and educational outcomes. This slide shows the requirements for single subject credential admission at CSULB. A grade of a B or better is required in EDS S300 and a 45-hour fieldwork requirement, a cumulative GPA of 2.67 in undergrad work, passing interviews with health science faculty, 2 recommendation letters, becoming certified in the CCTC, a negative tuberculosis test, basic skills requirements, and proficiency in reading, writing, and communicating in English. Most schools in California have graduate programs in health science and public health majors that can be used in the school health field. As a health education specialist certification, by taking the CHES or CPH is required of those trying to pursue a career in health education specialist. Those that are lucky enough to live in California will be provided with an abundance of unique programs and majors that can be of great use when pursuing a career in school health. Some of the majors and their requirements are seen in programs such as California State University Long Beach, California State University Fullerton, California State University Northridge, and California State University Santa Barbara. These are all great programs provided in California that will allow those with a passion in school health to become one step closer as working as a health education specialist in schools or other careers involved in working with students. To conclude the presentation, we touch on how schools have been impacted by COVID-19 and distant education. Health officials have had great involvement with school systems across the country. With the decision of most campuses to remain online, this has promoted a new and often difficult learning system on students. There's been a lot of adapting, not only in education, but as well as the health and safety of those attending school during a pandemic. Educators in schools take on responsibilities of promoting healthy behaviors for students, which includes wearing masks, social distancing, and proper hand washing. Schools are now required to wear masks on campus, and some may even require a temperature check upon entering. There are social distance classroom settings and screening of staff and children through COVID testing and questionnaires. School counselors are of great importance to provide resources and coping strategies for those affected by the pandemic. Thank you for taking the time to develop a deeper understanding for the importance of school health and how it affects students. Here are the references that were used to produce this PowerPoint presentation. And let's hope that one day school health can create individuals who advocate for the importance of healthy behavior. Thank you.